It's KSMO Radio in Salem, Missouri, your radio home for the St. Louis Blues hockey.
At the KSMO studio, it's time for us to sit down with our friends from the Salem Memorial Hospital. Our spotlight on the hospital at KSMO is on Wednesdays at 9:10, except for when we have the director in to talk about the board meeting, and that's usually the only week we don't have a special guest. But today we do. Tabitha Standfast is here. How are you doing, girl?
I am great. I'm great.
Always a pleasure to see you.
Special
and
guest.
We are going to talk a little bit about something that people may have heard in passing but may not understand, and it's called TORCH.
It's called TORCH. So TORCH is a Missouri Medicaid program. It stands for the Transformation of Rural Community Health. It's a pilot program that Missouri Medicaid has started. Salem Hospital is one of 6 pilot hospitals in the state. This is brand new in the country. There's other states that are contacting the Missouri Medicaid people and saying, "Hey, what is this TORCH thing? We're kind of interested in this." On the Missouri Medicaid side of things, the goal is to impact Medicaid patients or Medicaid prescribers or whatever that term is for them, the people who are on Medicaid or are eligible for Medicaid. The goal is to impact their health before they are sick. The goal is to maybe help them find resources, help them gain knowledge, understanding of disease processes or anything like that. So it's not about necessarily your blood pressure. It's not necessarily about your diabetes. It might be about your food. It may be learning to choose healthy food versus unhealthy food that would downstream impact your blood pressure or your diabetes or anything like that.
So things that you would do ahead of time to prevent you from getting sick.
Exactly. So, medicine is a big business. There's a lot of dollars that are spent, and Missouri Medicaid has recognized that the dollars that they're spending is to try to help people after they're sick. And so they really feel like it's worth the pilot project to see if they can make a better and bigger impact before people actually need medicine, need health care in general.
And maybe much more affordable to do it that way than to try and treat something after the fact.
Exactly.
Mm-hmm.
So
what's the first steps that you're doing here?
Well,
there's a bunch of first steps.
There's a lot of stuff going on. So this is something that the hospital applied for. This is kind of a grant program, but it's not technically a grant. But the hospital did apply for it, and we were one of the 6 hospitals. We started this last year, and I don't have the exact date because I've been doing a few things, and
you've been doing a lot of it.
I can't always keep track.
I think it was back last. It
was like mid-23.
I was going to say maybe August or September, somewhere in there.
Summer is when we were notified that we received that we were picked. The program itself works with a software platform called Unite Us, and that is a software that we went live with last Tuesday. And what we're doing with that is all of our community partners in the area, what we're going to start reaching out, and we have started a little bit, but we're going to start reaching out to get any of the charities, anybody that wants to participate, anybody that has resources in our community in Dent County can join Unite Us free. And that way, we at the hospital can send referrals out to those people that have the services that we've identified someone needs, and then they can also do referrals with each other. So it's just a referral platform. They have to have a little bit of training. They can advertise what services they have. So if you have someone that has food resources, if they have classes, they can put as much or as little on their access, and then other people that have access. So like us at the hospital, we can look at everyone that's joined to see what resources there are, and it helps us have a closed loop feedback on, hey, we're sending, we're referring someone out to this community partner. They get the referral in the computer. They can talk to the people, and then they can put in, like, this is what we did, or whatever. And then that way we know later on, maybe they come in for a hospital appointment or doctor's appointment at the hospital, and we're able to look back and see what were they doing, what have they been working on, different things like that. So it's pretty interesting with that part. So that's a community partner. It's really about the community. It's the hospital is the hub for this in the county, but it is a great way for us at the hospital to get out in the community, to find out what's out there as far as resource-wise, to connect with those resources, and to develop relationships with them.
And to maximize your community resources to the benefit of the people.
Yes.
Because a lot of people are never going to know they can go to this resource or that resource, or they may go to that one and not know the other one's there.
Exactly.
And both of them could help them out, but there was no way of uniting them because there was no link to let each other know what they offer.
One of the things that came out of a previous grant meeting, and I don't know which one it was. There's a few that we're involved in, but one of the big things was that there's not a Rolodex of the resources in Dent County. So there's some disconnect on people knowing, on people like us as healthcare providers knowing what's available.
Sure.
And on the people that have resources of being able to get their resources advertised or out there so that people even know that they're there. So that has actually been identified in more than one in one arena, and so this Unitas platform can actually help with that. So we're super excited about that.
And in some cases, Tabitha, these resources will be limited to maybe income levels or something of that nature, to where Unitas could eliminate that as being part of this group's need or whatever that need is. So that they're not wasting their time.
Exactly.
Because then they go out there and they try and, I don't want to pick on any institution, but say they go to location A and they say, oh, no, you don't qualify for anything we have. And then they go to location B and they don't qualify for anything there. But they don't know who to send them to where they would qualify. And then this program with Torch, you would have all that information for them right away.
They can have that, So all of those different entities can put that. If they have something that is maybe they're only maybe their services are only available to a certain population, income population, anything like that, they can put that information in their listing, so that when anyone is looking at what are the resources there, because they're searchable. The Unitas platform is the demonstrations that we've seen are awesome. It's going to be as good as we as a community use it. So
there you go.
The more people that use it and get on it, and the more information they put in it, I think the better that platform will be. And that's a free resource for all of the community partners that we're working with.
Wow.
So if we're not currently working with them and they want to work with us, then they just need to let us know. Like again, it goes back to, we may not know that they're out there, but we definitely want anyone that wants to work with us to
Tabitha, there's such and you mentioned a Rolodex of different things out there to make it easier for somebody to find them, but we all know that there's certain resources that are out there, whether it be drug addiction or recovery or whatever it is out there, that may be more of a one-on-one or a two-on-one type of deal where most people don't even know that they exist.
Right.
And in these cases, maybe there's not a huge demand for it, but if there is a demand for it, you need to be able to find it. And if you're not even familiar that those people are out there, it's not going to help anybody. And then, of course, they may get their one or two clientele, but there may be openings for other people that might need their services, maybe even more than people they're servicing right now, that would benefit a lot more. And so that'd be a fantastic deal.
Yeah. So Torch is the way that the Medicaid system is set up, and they're setting up the Torch program. It's really to address drivers of health or the social determinants of health. And what that's going to enable us to do at the hospital and on the clinic side is we're going to initiate screening. So it's like short screenings of, it's across the board, like it's evidence-based screenings that we do. So it's not something we're picking up out of, just picking up and saying, oh, well, let's ask about this. It's something that's recognized. So it's a general like short screening that like our patients will ask our patients some questions.
Okay.
And then that will trigger like maybe a further assessment is needed. So those are things that we don't have in place right now. And so that's going to help the hospital provide care for our patients, because it's enabling us to put in a case management or a care management model at the hospital that we currently don't have. And so Torch is actually funding the people that's going to be doing this.
Oh, wow. Okay.
So this isn't, I know that there's a lot of talk about the hospital and our financial situation and things like that, and some concern there. But this is something that Medicaid, this program is funding the people who are going to be running the program. It's going to be funding a program manager, so that's the person who is going to be helping actually run Torch for us at the hospital.
Collect these organizations,
Yep.
put it all together.
Yep, and that's going to be the person that's going to be out in the community, and is going to be talking with our resources, with our community partners, going to be really, really helping set up and be successful on that side of things. And then we will have at least one more full-time employee that will be like a care navigator or I think we're going to call that actually a community resource navigator, because that person is going to be really talking with our patients, following up with the patients maybe after their clinic visit or after their inpatient visit, when they have those triggers for that they may need a more in-depth screening to find out what resources that they could use and things like that. So this isn't something that the hospital's taking on and is like, okay, well, we're going to have to try to fit it into what we already have. This is the hospital is recognizing that using the funds that's available, we're going to be able to make this very successful.
If this would grow, obviously, because we've already talked about it, there's probably just a tremendous amount of services out there. Most people, patients, public, whatever it might be, are not aware of. We could actually see an increase in different types of organizations or services come in because of the Torch program, correct?
Yeah. Yes, I think so. I think this is a good opportunity for those community partners that do provide services. They could maybe expand their services or the things that they provide. And then there's also identifying different things that transportation is one that's come up in a lot of discussions, but there's resources that we are missing in Dent County, and this program can actually help us maybe set something up. It really depends on the particular resource that we are wanting to set up, but
Sure.
And also with that, this Torch, this is not just a hospital doing, and we're not listening, or we're not taking into account what the leadership of the community wants to do. This is actually requiring us, which is super exciting to me, to develop a leadership board. It's a community leadership board. And so of some of those community partners that we're going to be partnering with,
Sure.
we're going to ask some of those people to serve on this board. Right now, I have $60,000 in a bank account for that community board to spend on community partners. Like we have dollars from Torch for us to maybe one of our community partners, maybe they need a computer, maybe they can't help do some of this stuff because they don't have a computer. This community leadership board is going to be enabled to spend those funds on things to help this succeed.
Right, or maybe they need an upgrade in their internet service, because we all know around here sometimes it's not very good.
Exactly.
And if they're going to be on this network, you're going to have to be able
Yes.
to know that they can get your information.
Yes, exactly.
And so if you see those services, so that can help as
Yeah.
well.
So we're going to there'll be an application process for the funding, because we have to be good stewards of the dollars
Sure.
that were allocated to this.
It's a state program.
It's a state program. They want to know what we're doing with it.
Yeah, they want to know where their money's going.
Yes.
Okay.
But the leadership board will likely start in the next month. We're in the last day of our interviews for our program manager at the hospital. I had quite a few applicants for
That's
that
great.
position.
I think that's fantastic. Yeah.
That blew me away. I was super excited about that. So I expect to have a final decision on our program manager next week. I said that last week too, so that my goals sometimes are a little. I forget how many days there are in the week.
At least 8.
Yeah, I
not
know,
10.
right? But I think with this, once our program manager gets on board, then we'll be out in the community. We'll be able to start doing some of the work that goes with this. So.
And so, I mean, if you've got, man, maybe you're out in the community now and you've got an idea about a service that maybe you think needs to be offered in our community. And it might not be a bad idea to maybe put that out there, because obviously in the conversations that are going to be out there between these resources, somebody might say, never considered going into that field, but it's not that far off what we already do. Maybe we can look into that. Not to say they will have it. A lot of you can't force somebody to go into a service they don't offer, but it may open them up if there's a demand for it, Tabitha, to say, hey, I think we can fit that in.
Exactly. I think this is really a great opportunity for Dent County, that we're able to look at what we do have. We're able to support and hopefully, I want to say expand, but I don't necessarily mean expand, but expand the availability and the understanding of what is out there and things like that, and then grow. I mean, like, if there's something, transportation always bubbles up to the very top of every discussion that I've been in lately for any grant.
Yeah.
Across the state, every county struggles with transportation. But one of the awesome things is last Tuesday, I went to the in-person meeting in Jefferson City, and we actually spent an hour and a half or so with the Medicaid transportation people, and we were able to ask questions. We were able to give some feedback, and again, it's a state program, so sometimes things don't change very fast. But I came out of that or at all. But I came out of that with, at least they knew what was going on in Dent County and the struggles that we have in Dent County with trying to care for our patients and get them to their appointments and back home. We sometimes have patients that wait a long time for rides home. And that's, it's just something that happens, but this is a great opportunity to at least be able to say, there might be something there we could do with that. I don't know what it is. I'm not, it's not Tabitha's driving the bus there. I mean, because I don't know, but that's where the community comes in. There's
been talk about trying to expand transportation services. It's just difficult to do because there's not always a demand for the service. I mean, obviously, if anybody can picture somebody having to be taken to the hospital by ambulance and then you're discharged.
Yep. Then how do you get home?
So a lot of times there's been hospital personnel that have taken these people home, and there's that's just, it's not that it can't be done. It can be if you don't have a family member, but obviously having a resource that would be there all the time. One of the things, though, and I want to just kind of maybe step back to almost the beginning, and I don't know if this is even a logical question to ask at this time, and you may not even have the answer. But Medicaid is a state program.
Yes.
Salem was selected out of 1 out of 6 hospitals. Was it because of the amount of Medicaid patients that comes out of Dent County to see if they could reduce that by, cutting it off at the pass by getting these people healthy beforehand rather than having to pay for their Medicaid treatments afterwards?
So I'm not sure why we were chosen.
Okay, so you don't have that answer.
Yeah, I wasn't a part of the application process, but they haven't talked about trying to get people off of Medicaid. They've tried.
Keep them from going on.
Their talk is actually more about getting the people that qualify for Medicaid on Medicaid, but taking care of their health before they become sick,
right,
which reduces the dollars spent per enrollee or whatever, because going to a hospital, when they're sick, that's expensive compared to trying to keep them from being sick. And so for the hospital, it sounds like, oh, well, we might lose money, but it really isn't that we're going to be reducing the amount of Medicaid dollars that we get for those sick patients, because we'll be seeing them on the other side, beforehand. We'll actually
right.
be able to, so
Before they'd be going on
before
Medicaid to
yeah.
get this services.
Yeah.
So, and that's and that was part of why I was going to say this, because my next question was going to be if it was because of the amount of patients on Medicaid, but it's not going to affect those patients.
No.
Those patients will continue to get their Medicaid
Yep.
benefits.
Yep.
It's not affecting you. It's trying to keep the people who are borderline right now, getting ready to, if their health continues to decline, they may have to go on Medicaid. But if they can get them healthier, they won't have to go on Medicaid, and that will save the state money.
Well, kind of, but they're not really worried about, like, if you're on Medicaid or not, and trying to keep people off of Medicaid.
No. I mean, but I'm just trying to keep them healthier so they
They're
don't
just
have
wanting-
to go on
yeah.
Medicaid.
So this is a Medicaid program. So the torch itself is really just for those Medicaid patients, and the goal is to, if you qualify for Medicaid, they would like to see you on
Sure.
Medicaid, but they want to take care of you before you're sick. Before, like, they want you to, like, maybe you are obese and you have high blood pressure. They want to make sure that you're maybe exercising or you have good food in your house, things like that. So those are some of the things that the social determinants of health screenings, those are the things that they're focusing on, because the social determinants of health, which they look at housing, that looks at transportation, looks at food, looks at activity levels, all of that type of stuff. Those are some of the screening questions that you might here on the general screenings, the short screenings. What that does is it takes that those screenings, and if they screen me and they say, well, how often do you exercise? Well, that could be a big fat zero sometimes. They might say, okay, well, let's get you in. Maybe we could offer scholarships to the gym. Things like that, so that we can induce the patients that aren't patients yet, like, to help themselves before they need help. So it's really it's not really backwards, but it's really trying to take those patients, that population, and help them today instead of treat them tomorrow. I don't know if that makes sense, but
it does, and I don't know if there's any easy way to say it. It's like if you are on Medicaid and they don't want you to get worse. They want you to to stay where you are or get better.
Yes.
And
Exactly.
and if, kind of like in your situation, okay, let's just say that Tabitha doesn't have the time to exercise, and you really don't. But let's just say you got on a program and all of a sudden, maybe you're off of medication.
Right, exactly.
Maybe you've gotten that blood pressure down. Maybe you've either dropped weight or
Exactly.
your metabolism has changed. Whatever it might be, that makes you feel healthier, or you're healthier.
Yeah, it
or
makes you
all
feel
your,
better.
Yeah.
It's a win-win thing, and so that's why the focus is upstream of health issues. It's focusing on things that we can do today to prevent needing to be in the hospital tomorrow or next year, or even in 4 or 5 years.
In today's society, in Tabitha, and I'm not knocking drugs, so I don't want anybody to take it the wrong way, but unfortunately, we all become pill-oriented. We can take a pill for that. I have a headache, I can take an aspirin. Okay, that's fine. I get that.
Yeah.
But if I'm not going to exercise, I can take a pill to lose weight.
Exactly. Yeah.
Okay, yes, you can. Is that the best thing for your body? Probably not. Maybe the best thing for your body would be to get out and walk a mile. Maybe eat the better foods that you can do. Yes, I think you can do that, and then that's going to help your blood pressure. It's going to help your body circulation. It's going to help you it's going to open up your lungs a little bit, so you're going to breathe better. I mean, there's a lot of different things. I'm not saying you got to go run a marathon, but if you can just do a little bit, and if the Torch program will help push people to do those kind of things, I think it's a fantastic program if they give them the incentive to do it. Right. I mean, the incentive to do it is better health. That should be everybody's goal, right?
Yes. Yeah, and this isn't something that if say there's a screening that takes place and they we think, oh man, you could really benefit from a referral. That doesn't mean you have to. Like, that's not something that you're not required to do it. But we might educate and give you all the reasons that we can come up with, or that that's out there for. Here's the things that you could benefit from. Here's the things down the road that you might start facing, and things like that, just to help educate. I think education's a big thing.
It is.
Sometimes we don't know that certain foods aren't good for us if we have, if we're diabetic, or if we have high blood pressure. So it could be just as simple as connecting them with those kind of resources. I can see this being a lot bigger than it's starting out, and of the 6 hospitals, there's 2 of us that do not currently have like case management or care management models in place. And so that hospital and our hospital are working together to make sure that we put in place the things that works for us as a small community hospital, and works for our community, because it's not something that works. Things that work in one hospital 2 hours away, or anything like, may not work for us at Dent County.
That's right.
So we want it to be something that's going to work for us at Dent County.
I've heard some things about psychiatric services and things of that nature, which there's not a lot of in rural America. There just isn't. I mean, there's not a lot. And a lot of times, and people, and I've heard it being said, it is a science that's not unable. Well, how do I want to say it? It's a science not available to these people, to where many times their physical problems are basically coming from emotional or mental issues, to where if they could talk to somebody, if they could get these things out, that they would be a lot healthier overall.
Yeah.
This Torch program may actually lead to those kind of services being available to some of these people.
So we Compass Health is identified as one of our community partners. It's a healthcare partner, so the referral process might be a little bit different, but they have attended our Torch meetings and are very excited to work with this program with us, and in whatever fashion that we can. So we're definitely keeping the behavioral health, mental health aspect of that,
because that's part of their network.
That's part of it, yeah. And that's part of being healthy too. So it's not just about your physical health. With the Torch Project, we might identify other needs or something like that we need to connect people to.
But mental health can affect your physical health too. I mean,
yeah.
When you see people get depressed, it can drop them down to an area that they have no hope, or maybe they just feel like they can't go on, and things can change drastically in a heartbeat. I think all of us have gone through moments where, I'm not going to say depression, but moments of confusion, where we're not sure which is the right solution.
Sure.
And we put a lot of pressure on ourselves, and that pressure takes an effect on your body.
Yep.
I think a lot of people just may not truly understand just how many different things can affect you, from food to diet to the food types, to the diet you eat, to exercise, to having a clean bill of mental health.
Yeah. And this is something the Torch Project is going to help us look at our patients, or look at the community as a whole, instead of us at the hospital just addressing your blood pressure or your high cholesterol or something.
Your physical health needs.
We're going to be able to start looking at and do something with your whole health. So you as a whole person, and we already do that, but it's not anything as we don't have set processes in place. So one person may go in and may have a different experience than another currently. And so we're the part of this Torch Project that's exciting for the hospital is this helps us put a process in place for all of our patients.
That's a standard process.
It's standardizing the process.
Very
exactly.
good. Fantastic.
Exactly.
I think it's a beautiful program. I'm hoping everything works out well, and I know that you're excited about it. And if you're excited about it, that means a lot to me, because you look into this stuff and you realize, like, this can really help our community. And I know how community oriented the work that you have done in the past, from STEMI and all the different things that you've really gone into. One of the things that I hope people understand, our hospital is really trying to open these doors for community uniting our community together for health care. It's really a big driver. This is a big driver of that.
Yes.
But that's what it's all about. The Delta Regional, all the different things that we're trying to incorporate. The hospital is really coming out on, I'm not going to say going out on a limb, but they're trying to bring those things here. It's not easy. Rural America and small critical access hospitals, they're falling by the wayside left and right. And we don't want to see ours do the same thing because of the importance that it has in our community. So,
Exactly.
I hope people understand. They say, well, it's just a small hospital. It is a small hospital. But you'd be doggone be happy if something happened to you and you had to go out there to get stabilized, to be moved on. And that's
I've
a
always
big part
said,
of what we do.
I've always said that we're small, and being from the ER, and developing our stroke and STEMI programs and things like that. Yes, we are small, but that doesn't mean that we're not mighty. We do a whole bunch of good healthcare. We do a whole bunch of good things for our patients that not every small rural hospital can do, and we do it really well. And so it's something that if that was gone, it would be missed. It would be missed,
It'd
and
be
so
devastating.
yeah, it's definitely something that it's hard to believe what all a little small hospital has to know, has to be able to do, has to. I have nurses that have come from big city hospitals in the past, and they come down here and they're like, wow, I mean, I had no idea that you guys would do some of the stuff that you do, and that your education is so much that you got, because our nurses, if I worked in a larger hospital and I worked on just one type of patient, I wouldn't have to know a whole lot about anything else. And at our hospital, our nurses, our medical staff, they have to know a whole lot about a whole lot of things. Or sometimes a little bit about a lot of things. It kind of, it's just not something that is, you can specialize in one area and just forget about everybody else. So that's one of the neat things about the hospital, and that's one of the things that I've always loved about it, is the fact that the more I know about a lot of things, the better I feel as a practitioner and as a nurse that's taking care of patients. And that's what I feel like we as a hospital, we do really, really well. So.
Well, the one thing that I've always said about the Salem Hospital, and I've been in the hospital a few times, so I know what it's all about. It really is. It's not about the equipment. I mean, it's good to have brand new equipment. It's good to have this. It's about the people. And the people absolutely do a fantastic job down here. You're always going to have somebody who may have a bad day. They're not going to be as hopeful and friendly than you might want. But for the most part, if you've got a question to ask them, if you've got a problem, they're right there ready to assist you. When you walk through the hospital, if you don't get a hi from every single one, I always do.
Yeah.
If somebody see you in the hallway, hey, how you doing?
Yep.
Doing good. You know, or maybe you're not doing good that day. And I've been better. But virtually, Tabitha, I've been to big city hospitals. I always go back. I've never been a hospital kind of guy where I've always been in the hospital. My father got elderly and had to be in there, and I had to go deal with a bunch of people in the hospital. Big city hospitals do not impress me.
Yeah.
They knowing after I've been in a small rural hospital, the big city hospitals, you feel like a number. You're treated like, I can say, like oatmeal.
Yeah.
Either they love you or they could care less.
Yes. Yeah. The nice thing about the small being small, being a small number. We have, I don't know how many employees we have, but we know, I know almost all the employees. It's one of those things where you end up being a family. Sometimes you're just as dysfunctional as every other family, but that's okay, because that's what makes us work well.
Sure.
Because you can't always agree, and you can't always. Sometimes it is healthcare. Sometimes it is stressful. Sometimes you have to be able to do the best thing for the patient, and then figure it out later. And but because it's about the patient, that's the key. It's everything that we do should be about the patient, and sometimes that means doing things like looking for torch projects
Exactly.
that that's a big leap for us at the hospital because we don't have the staff to do it. And it was kind of like, oh my gosh, how are we going to take on this? How are we going to take on Delta? Like those, but those are things that in order for us to stay, in order for us to be here, in order for us to implement great things for the community, then we have to do that kind of stuff. And so I'm super excited about this particular project. I think this will be great.
Sounds like it really could be a benefit to our community, not
Yes,
just the hospital, but
exactly.
our entire community. And hopefully everything progresses. And hopefully you get your 2 people that you need here in the next
Hopefully, yeah.
short time.
Very soon to have the program manager, and then
I won't put any pressure on you as to next week or anything
yeah,
like that.
yeah. Well, next week sometimes it becomes next week, but and then our estimated go live on the program itself is April 1st. That's
pretty aggressive.
That's not necessarily when Salem Hospital has to be up and everything running,
Right.
but that's when the Torch program is estimated to be up and line.
But that's still pretty aggressive.
That's pretty aggressive.
Yeah.
Yeah. Yep.
All right, very
It's
good.
a work in progress.
It is. Well, Tabitha, we appreciate you giving us really kind of the dirt on the Torch program. I mean, I think people have heard the term being used. I don't think they had any idea what it was. I know I had only gotten surface stuff about the Torch program, and even though I know somebody that knows a little bit more about it, still didn't know much.
Yeah, it's hard because it's brand new, and even the state is working. We're figuring it out as we go. I think I'm back in a couple of months, and I'm really hoping by that time I'll be
Have a
able to
guest with you.
Yeah.
Maybe you can bring
maybe
in
a program manager
there you go.
or a navigator or both.
Or both.
Yeah.
Yeah.
So that's my plan. Is our next visit with you, I'll have more updates. See where we're at.
And we'll have more information on the Torch program as it gets closer and closer.
As it gets going,
Yeah.
we'll get going.
We'll get that information out there so people have a much better idea. Tabitha, as always, really do appreciate our friends from the Salem Hospital coming and spending some time with us, informing us about things more than likely people would not hear about anywhere else. And we really do appreciate that. And Tabitha's always been a wealth of information, I'd say for a lot of years, but I won't say that. I'll just say for quite a few years. How many years you been at the hospital?
Since 2003.
Okay. Very good. So 20 years plus,
it's
give or
been-
take.
Yeah, it's been a while.
All right, well, great. Well, anyway, we always appreciate your input because really that's how we learn about things that we don't know anything about. Listen to what other people have to say. And you've been, like I said, we've been working on this Torch thing now for at least 6 months. Probably, I think it was August is when it actually got approved
I think
to
so.
go forward.
Yeah.
And so now that we're in February, end of, but 6 months of work, it's all preliminary work still and not quite done yet.
Nope, more work to go.
Very good.
Thank you.
Tabitha, have a fantastic day. You keep it here at KSMO, and we're going to have our Civic Record coming your way next. Comes your way right after this short